On June 25, 2009, over 5,000 Americans gathered in Upper Senate Park next to the Capitol, demanding a public option in our healthcare reform movement. Among those speaking was Howard Dean with Democracy for America. We were there to deliver over 700,000 signatures demanding a public option, and we delivered them to Capitol Hill.
First of all, these are great people from Democracy for DC, and they are delivering 400,000 signatures, 70,000 of which were achieved in the last week, to support the public health insurance option. Let Americans decide. 72% of Americans believe that they ought to have the choice. Not bureaucrats in the insurance companies, not the Congress, not people who take money from the insurance companies, that the people who want to make that choice are the American citizens. They voted for change we can believe in, and now we want change that we can believe in. So thank you, DC, for democracy, and thank you, Democracy for America. Thank you, HCAN, and thank you to the labor movement of the United States of America for putting this all together. There are going to be a lot of workshops afterwards. I'm doing one for nurses and doctors along with some other folks. We want you to go to the workshops that you care about. This is a gathering of ordinary Americans who are petitioning their government. 72%. 72%. What part of 72% do you not understand? We're not asking for a specific system. We want to be able to choose. Trust the American people. For too long we've had elections, and then people go back to Washington and think, okay, the election is over. We don't have to wonder anymore. This is just the beginning. We don't just need, this is an incredible rally, but this is not good enough. Every day we're going to be on the internet. Every day we're going to be on email. Every day we're going to write our congresspeople. Every day we're going to make phone calls. This is a government that we elected for real change. We want that change now. Now, we know that the Republicans are doing everything to say no. They're well organized. They care more about the health insurance industry than they do about the public. They do. They are in the insurance industry's public pocket. They don't care. What about the Democrats? You all voted for Democrats. Democrats won overwhelmingly. We didn't just win in New York and California and Michigan. We won in North Carolina. We won in Delaware. We won in Indiana. We won in Montana. We won in North Dakota. Boy, I better be careful of doing these lists, shouldn't I? We won everywhere. 50% of Republicans believe that Americans ought to have the choice between what they have today and a public insurance option. What we say is we are here. We're not going away. We voted for change a few months ago. We expect change. And if we don't get it, there's going to be more change. We want public health insurance option now. We want to choose. The American people can be trusted. We grew this movement. We're going to keep this movement. The Senate works for us, not the other way around. Thank you very much. Thank you. Thank you.
After the rally, many people visited their representatives and senators demanding a public option in healthcare reform. The Democracy for America delegation visited the offices of Senator Webb and Senator Warner, both from Virginia, delivering petitions from Virginia voters who demand a public option in healthcare reform.
There, we're going that way.
We first visited the offices of Senator Jim Webb from Virginia, who still hasn't taken a position on the public option, although his staff was very helpful and courteous. Please, if you're from Virginia, contact Senator Webb and ask him to support a public option.
The insurance companies discount their payments so that even with the best insurance, you can end up with massive balance bills. We really need a public option. I know that Senator Warner is supporting it. I'm surprised that Senator Webb has not yet agreed to support health care owner.
My story is that while I was working on the vote campaign, I stopped at a red light because I was a driver and my insurance company refused to pay my medical bills.
Because it was an auto insurance. Auto problem, not a health problem. They play those games all the time.
I had a $50,000 Medicaid policy with State Farm, and they just refused to pay. And in the state of Virginia, that's perfectly legal. It's considered good business policy for them to do that. And, you know, everything is stacked against you. And if it wasn't for my getting disability and getting Medicare, I would have no hope of having a quality of life whatsoever. So Medicare has saved me because my insurance company refused to pay. So it's very, very, very important to have that public option.
Senator Webb's aides were very courteous, very professional, and even gave us Senate gallery passes.
Passes here. Anybody want to go see the Senate gallery? We never get up there.
I've never been there. Let's go.
Yeah, let's do that. Let's do that.
Awesome. Next, we went to Senator Mark Warner's office, also from Virginia. An aide for Senator Warner met with us, listened to our concerns, and accepted our petition of signatures from Virginia voters.
Actually, copies of signatures of Virginians who have signed a petition in support of the public option. There are about 100 per page, and there are a lot of them. And so I just brought you some copies along with a letter that says that if he really wants to see the entire list, there are at this point not 350,000 but 400,000 supporters. There have been 70,000 people signed on in the last 24 hours.
And that's
to the public option. And we are grateful that Senator Warner is supporting it. We want him to stay really strong for really robust public option.
I want to do what I can to make sure that other people don't have to go through what I've been through.
Kathy's a nurse. She sees the problems that it causes every day. She's a psychiatric nurse.
That's unbelievable. I worked for a managed care company several years ago, and I would be rewarded if I would deny care.
So all in all, the experience was wonderful. We saw how accessible our government was. The staff was courteous and listened to our concerns and accepted our petitions. And it just goes to show it's still a government of the people, by the people, and for the people. Please contact your senators and representatives and ask for a public option in healthcare reform.